one of the things that gets lost here is that there's an opportunity cost in the sense that there are trade-offs here. There are pay-fors, particularly in the prescription drug area, that have long been on the table that could be used to offset new spending. But I mean, to be used to offset spending that was already on the table that wasn't paid for. And so now it's being used to fund a new source of spending. And so even if it all comes true, you're still not doing anything to address the underlying problem that we already had. Are there some ways that the prescription drug pricing could be enhanced further from what they've done now?
Yeah, I think there are really two main ways to think about it. One is you could make the negotiation from the Health and Human Services Secretary stronger. Right now, it's pretty limited. The number of drugs is limited. The amount of discounts that they're allowed to negotiate is limited, and the length of time after a drug has been on the market is limited. And you could change all of those things. Just for perspective, when the House passed their prescription drug negotiation bill a couple years ago, the CBO said it would save about $460 billion for negotiation. In this bill, we're saving about $70 or $80 billion from negotiation. So there's clearly a lot more savings that can be done on that end. And perhaps after we experiment with this for a couple of years and we realize that the drug industry is still profitable, maybe members will be willing to go a little further there. But then there are also other areas of drug pricing that still remain out there. We have hardly any competition in Medicare Part B for drugs. So we think you could save a fair amount of drugs by opening up some competition, especially in drug areas where there are multiple drugs that treat the same condition. That's something that we've worked on at the Health Savers Initiative. And then there are a lot of other ideas. One of them that I've heard floating around the Hill is to in some way tie drug monopolies to the value that we get from those drugs. I think that's a real interesting idea and is definitely worth members exploring and policymakers exploring. So those are just a few, but we certainly have more that we can do on prescription drugs and obviously in healthcare costs in general.
Mm-hmm. I think one of the hardest things about addressing the high cost of prescription drugs and the rapidly growing cost of prescription drugs is that the pharmaceutical industry is really good at saying, if you mess with repayment or if you mess with, like, for example, drug price negotiations, et cetera, we're going to stop innovating. Or if you have cancer, you're not going to be able to get the life-saving drugs that you need. I mean, that those ads go up on TV immediately. It is really easy for the pharmaceutical companies to message, no, stop, don't. And it's really hard for policymakers and lawmakers to message, yes, this is okay, this is going to work, this is going to help you, especially when it comes to prescription drugs. How do we get past this?
I think we get past it because members of Congress know better and they don't have to fall for this. We're not talking about nationalizing the prescription drug industry. We're talking about taking a little bit of haircut in profits or tying those products and their pricing to the value we're getting from them. Bob and I have talked on this podcast before about the Alzheimer's drug in Medicare that has hardly any benefit and is super expensive. And so clearly there's something wrong with the drug approval process. That drug was approved despite all of these things at a very high cost. And I don't think there's too much evidence that if we stop approving drugs that don't work, drug companies won't invest in finding drugs that do work. That doesn't really make much sense to me. So, I just think it's a matter of members of Congress knowing better. Plus, this was a great opportunity to do something for seniors on drug pricing. we capped out-of-pocket spending for seniors, a great carrot to get more customers for the drug industry, ensure seniors can afford their medicine. And so it was very ripe time to also include some things that dealt with drug pricing, to pair the carrots and the sticks. Unfortunately, we could have had a $450 billion stick instead of a $70 billion stick. But I mean, that's the kind of thing that we look for going forward. And if we're really concerned about things like vaccines and special cases like we have experienced with the COVID vaccines, there are other ways to incentivize that don't involve paying hugely high inflated prices for all drugs across the board, regardless of value. That really is a very inefficient way to incentivize this sort of investment, I think.